Live from WDEF News 12 at 6 starts now. Straight ahead on News 12 at 6.
A local doctor uses a new procedure to ease the pain of patients with varicose veins.
You're watching WDEF News 12 at 6 with John Mercer, Renee LaSalle, Chief Meteorologist Patrick Cole, and Rick Nyman with sports.
A new procedure performed in Chattanooga gives residents with varicose veins a new lease on life. Now, previous options like vein stripping proved pretty painful, so many patients let the disease go untreated, which could lead to ulcers. WDEF News' Joe Legee tells us about this medical breakthrough.
I'm going to get you to sign in. Okay, thank you.
Allison Noma suffered from the pain of varicose veins for nearly 30 years. She recently sought help after learning about a new treatment that doesn't involve vein stripping.
You get used to the pain, but it's uncomfortable, and as you get older, it gets worse.
Noma underwent a procedure known as radio frequency closure on her left leg last month and returned on this day to fix her right leg.
Almost immediately, I could get up and walk around, and I had so much energy. I can think clearly. I'm not lethargic and tired all the time like I was.
Make some small incisions along there.
After mapping out the veins, Dr. Griffin Coates, a pioneer in this procedure, uses ultrasound to verify the vein in question.
This is the vein that we normally would take out to use for coronary artery bypasses. But if this vein is enlarged and dilated, we wouldn't use it.
Radio frequency closure involves sticking a tiny special catheter into the diseased vein. Using RF, a small portion of the catheter heats up, causing the vein to collapse.
This is the only portion that heats up.
Like other physicians, Dr. Coates says he used to tell patients to elevate their feet, wear support stockings, or exercise more to treat the symptoms of varicose veins. That changed when he had the procedure done himself.
You don't feel like walking when your legs, when it feels like you're carrying 10 pounds of ankle weights by 4 o'clock in the afternoon.
The former heart surgeon believed in RF closure so much, he left his original field to bring the treatment here. In Chattanooga, Joe Legee, WDEF News 12.
Now, the outpatient procedure takes about 2 hours to complete, depending on the length of the diseased vein. Many patients actually do return to work the very next day.